when you mean surgical assist, are you just talking about like cortical puncture or the whole SARPy where they do like a LaFord cut?
Good question. I would say surgical assist is an umbrella term that includes all of those
Okay,
things.
yeah.
Um, when I say surgical assist, and when I say the cutting edge of surgical assist, I'm talking about the best ways of helping the MSE split the suture. That could be dome, which is the full-on Sarpi cuts, the Lefort cuts, where they actually cut the maxilla here and then
Hmm.
chisel down the middle. But avoiding that, what they used to do was they would either do nothing or they would do cortical puncturing.
Hmm.
Now there's a third option. And that third option is the piezoelectric bone saw,
Okay.
where they come in from underneath. It's not like the E's where they go in through the nose.
Hmm.
They come in from underneath and they hit the palate with the bone saw. The bone saw essentially looks like a fountain pen sort of,
Mm.
but it generates heat and they just I've never seen it actually being done, but essentially they just score the mid palatal suture with it and then it splits.
I see.
And the orthodontist does it under local anesthesia in the
Hmm.
office.
And so, what's the difference between the cuts that the ease does, besides the fact that it's through the nose? Like, where exactly do you know that they cut? Is it
I don't
this?
know.
Mm.
I don't know, and my sense is that Dr. Lee is kind of secretive about that. Although I shouldn't say
Mm.
that because I really haven't done due diligence, but it's not easy to get answers to the anatomical process of what he does, like actually endoscopically. But he's somehow able to get a full release of the suture from front to back through the nose, from top down, which, um, and then combined with his appliance, which, you know, rather than using
Hmm.
screws that are placed perpendicular to the direction of the force vector,
Yeah,
they're, parallel to it. And so you get less appliance distortion and you get, more reliable splitting action directly into the maxilla going side to side.
mm.
But even his appliance fails sometimes due to resistance from various other sutures throughout the face.
Yeah, I see. Do you know if the piezoelectric cutting option reduces asymmetry at all?
It helps. So there's a lot of ways you can mitigate asymmetry. Number one is with a surgical assist properly done. What that does is it takes the burden off of the appliance from actually splitting the suture. Because what happens is if you count on the MSE to actually do the dirty work, it gets a little fucked up in the process. It's like a infantryman soldier. Like it'll go in, it'll get the job done, but after he does that dirty work, he's going to be beat up and tired and could be injured. And so you don't want to waste the appliance's integrity on the dirty work of splitting the suture because it can twist. The screws can get messed up during that really intensive splitting phase. And a lot of bad things can happen that twist the appliance and distort it, which can then cause the asymmetry after.
Mm.
Another thing you can do, which is related to that, is just being very careful about appliance placement because the direction, the orientation of the appliance is critical. If you install the MSE diagonal, it's going to expand diagonal,
Yeah.
right? And you can install it straight, and then the appliance can get beat up in the splitting process, and it can become diagonal. So
Mm.
ultimately, we're talking about orientation of the appliance is super important. And that's why Dr. Lipkin, in his most recent interview with Mike Sadowski on Mike's channel, said ever since he stopped outsourcing the fabrication of his MSEs and he started basically designing and building them himself, his success rate went way up
Mm.
because
Wow.
essentially the labs were screwing up the fabrication, which caused the appliance to not always go in as perfectly as he wanted.
Mm.
And this kind of goes back to what I've been saying for a long time, which is that it's so important with MSE to work with an experienced provider who like knows these ins and outs.